have here today to help explain what our benefits are and what we need to do during this open enrollment process. First off, I would like to introduce Steve Brzezinski, which I'm sure everybody that has been here recognizes him. He's been here
a long time. I
many
had much
times.
more hair.
And then also today from Highmark we have Rena Carr and Stephanie. She said, don't even try to say her last name. So they're going to be here to explain what our benefits are through Highmark as well. We also have Ethan Troutman. He's from our Employee Assistance Program, Mazzetti and Sullivan. He has those really cool pens that Shannon loves and she's all excited about, right? And then we also have Les from Aflac, and she's been here quite a few times too, right?
Years somewhere, yeah, I've never seen her, yes.
So, what I'd like to do is start out by asking Ethan if he would come up and explain what all Mazzetti and Sullivan offers our county employees. Thank you.
Well, good afternoon, everyone. My name is Ethan. I'm here with Mazzetti and Sullivan, the AP. How many here have heard about the Employee Assistance Program before? Raise your hands. Okay, most, a lot of you, great. This is going to be brief, just a little refresher here. Just to review, each person here, what we do is we provide counseling sessions to you and your family members living in your home. We cover the first 3 sessions of counseling for you and anyone in your home, and that is renewable after a 2-month break. So our goal is to help you with whatever issues that you may be having, but resolve those. So, and also while not taking the place of your health insurance. So if those issues are not resolved after a 2-month break, you can come back in, get 3 more sessions. So if you attend with a spouse, you get 6 sessions together. If you attend with a spouse and one of your children, you get 9 sessions together. So it really does expand out well. It is a great benefit. I do have a few things back here in the back afterwards if anyone would like some information. We do have this new flyer here. This gives a good overview of the sessions we cover, how to access us. The best ways to access us are via email or via calling us. That's on all the materials that we have back here. We used to have trifold handouts, but we got rid of those. And also something new we are doing, started in January of this year, is we do now offer virtual counseling with a lot of the health insurance companies and with Teladoc and seeing a doctor over the phone. We're really trying to go along those lines here with the virtual counseling. It allows you to see counselor face to face while in the comfort of your home, while using your phone or tablet or your laptop. So it's really a simple, easy way to see a counselor if that's something you want to do, but might not be comfortable seeing them in person. So that's something we're offering now as well. If you have questions about that, feel free to ask me. And the third thing I do have back here in the back is our work-life resources on our website. There's a lot of self-assessment tools, self-quizzes on there, recipes for healthy living, legal documents and forms. There's a lot of information on the website. If you have questions on how to access that or how to use that, please let me know. Like I said, our phone numbers on all these things. Also, like Gary said, I do have these pens back here, and just so everyone's aware, the top is a highlighter, so feel free to use that as well. And also, I find it easier than holding onto these papers all the time. These are great for your wallet, and this has our phone number and email on it, how to access us. That way, if you ever need us, or God forbid a crisis comes up in your life, it's an easy way to get a hold of us if you ever need us. Is there any questions that anyone has about how to access us or how the service works or anything like that? Okay, easy enough. Well, thank you, Terry. I'll be in the back here afterwards if anyone has questions.
And what I would like to say too about your website, it's really awesome. If you've not had a chance to go into the Mazzetti Sullivan website, there's a lot of resources in there, a lot of things. It's very overwhelming the first time you're in there because there's so much.
It still is to me, and I see it
Yeah,
every day.
I spent like an hour one day, and I know I didn't even touch like on, probably not even the tip of the iceberg. It's very informational. There's a lot of information, a lot of good information in there. So I would strongly suggest that, you check that out and get an opportunity. There's some seats over here still if you guys wanna come in. There's one over here, one right here by Moon. I heard he doesn't bite.
She had it saved for somebody.
Oh, okay, alright. Gotta check with Jen first, I guess.
She said she would.
Alrighty. And did you guys get packets that just
Yes, ma'am.
arrived? Okay, perfect. So, what I'd like to do next is to ask Leslie to talk about AFLA.
Hi everybody, it's good to see everybody again this year. I call when you just wanted to, just so you know. I'll talk to you later. Yeah, open enrollment again this year. You know me, I come around throughout the county, so this won't be the last that you'll see me today, because I do try to come to all the individual different offices so that we have time to go over different things. Inside your packet, on the one side, I do have an information sheet again, like I usually do. And if you can just mark your name at the top, and then as I go through and talk, if there's something you think you're interested in or something you want to do, you can just mark it, and then that way I know when I'm coming into that specific office that you specifically want to see. How do you like that word, specific a lot? So, also at the bottom, I put down here that I think I have a claim and need help, and then another one said I would like to review my policies. A lot of times people forget what they have, so I do like to review, because over time, even though we think we know what we have, we don't always. And a lot of people are getting so they're filing their claims on their own now, which is really awesome. But I find when I go back and talk to those people, a lot of times they don't file for everything that they can possibly get. So if you've had a claim this year and you're not quite sure that everything got paid, just make sure you mark down there, and then that way I can get together with you and go over it and just make sure you did get what you deserve to have at that time. This year, I'm not going to go over everything individually because I've done this so many times. I think you all have a pretty good idea what AFLAC is all about, knowing that it's a supplemental designed to pay in addition to your major medical. We do your short-term disability, which is designed to protect your income. So if you cannot go to work due to an off-the-job accident or due to a sickness, it becomes like a partial replacement of your income. We have an accident policy that a lot of you have and utilize, and it's an excellent program. Especially like if you've got kids that are in sports and whatnot. It's a fantastic program. When my kids were growing up, it was probably my most favorite program because it seemed like I was collecting all the time. We all like to collect off of the things that we have. As I got older and my kids grew up, I thought I was going to cancel it, and I did not because I'm a procrastinator, and I was really glad that I didn't because now that I've gotten older, I seem to do stupid stuff. So it's like little things happen that you have to go get checked out for, and so I still have my accident policy, so I like the fact that I can still collect from it. I don't make out on it like I used to, but yet it's still in place there so that if something real major was to occur, that I would have good protection there. But I find that it usually pays for itself each year. Also, AFLAC is very well known for their cancer programs. There's a cancer brochure in there. We do have a couple different programs that you can pick from. This is option 2. Every year, well, not quite every year, actually our policies have changed a little bit again over this last year. AFLAC has a tendency to do a lot of research to know where the healthcare market is going, so that we change our policies so that they're paying out the most they can to you if a claim does occur, whether it's cancer or hospitalization or whatever the case might be. So I mean, if you're interested in looking at the newer program, just let me know, and we can always upgrade to it if you feel like it's better or whatever the case might be. We also do the little hospitalization policy, because you have the HSA now. Of course, we have to do the HSA compatible. So basically what it's designed to do is kind of help out with the deductible. So I mean, you can actually pick what you would get if you were to be hospitalized for 23 hours or more. So you can pick $500, $1,000, $1,500, or $2,000. And there's a few other little benefits under it, but not tons, because it's just designed to help out because of the HSA now. Other than that, our programs have pretty much all stayed the same. I did want to point out in the packet, I also have in here on now get your claim payment even faster. I don't know how many of you utilize the online. With AFLAC, that is definitely, like with every other company, that's the way every company is moving, is that you do everything online. So you can go in under the myaflac.com, set yourself up with a username and password. When you do that, you can go in, and they have different buttons, of course, and one of them says direct deposit. So what you want to do is go in under and set yourself up for direct deposit. We now have what's called the one-day pay, which this is not in your packet, but I do have some of these little brochures over there. The one thing nice about the one-day pay is that if you are set up online and you are set up direct deposit, if you go online and you file your claim before 3 o'clock in the afternoon, our promise to you is that that money will be in your account the next day. So far, that has worked. Now, the only challenge with that working is people that are still faxing their claims in or mailing them in, it takes longer. We've actually got behind on those. They are working to catch that up, so I wanted everybody to know, so if you haven't got paid, like Sue has not, not as quick as she usually does, it's because everything has fallen behind because of the one-day pay, because they are trying really hard to get people to do it this way. Less errors that way. If the paperwork isn't handled by you and then go to me and then go to Aflac and go to all the different departments, it just makes it easier for everybody. So you get your money quicker by doing that. Now the only program that we really can't do that on is your short-term disability, because that requires, you know, your employer section and your physician filling out their section. So we still can't do one-day pay on that, and you can't do that online either. But you do want to get yourself set up online because it is much quicker. If you have an issue with it, my card is in the packet. Please feel free to give me a call. Don't get frustrated with it, because some of us that have gotten older over the years, things when it comes to technology, it doesn't come quite as easy as it does to younger people do. And so it's just one of those things. Don't worry about it. Just give me a call if I need to stop by and help you get things set up. That's what we'll do, because it is much simpler to do it that way now. Also, just to make it a little bit easier or more difficult, whichever way you want to look at it, we now have an online app also. So we have the Aflac application that you can actually download onto your iPhone, which makes it all the easier to say yet. Now, I have not used this. I do not know. I know it's just a matter of going in, filing. I think you take a picture of your claim and you send it through that way. Which, I don't know if you're like me when you're trying to take a picture of something, you know, trying to hold it right so you got the picture, you can actually see it and your words aren't wavy or whatnot. But we have the mobile app now too that you can do. So, give it a try if anybody has a claim. It's real simple with your wellness benefits now. I mean, you know, a lot of you have wellness benefits. You've always, you know, just faxed it in or whatever. Just get yourself set up. Now, if you have not set yourself up for direct deposit yet, when you go in to do that, give yourself a full day before you file a claim, because that connection between the bank and Aflac has to happen so that the money actually goes to you. If you do it too quickly, then they're going to still mail you that check, which right now, just the mail system takes 10 days for a check to come up from Georgia. So everything has just gotten slower. So this will make it so that if you really want your money quicker, is definitely the way to do it, is by going online and doing it. But like I said, if you have challenges, make sure you give me a call so I can help you out. Any questions? Anybody? Good? Okay. But I'll be coming around to all your offices, so if you need to see me or whatever. But if you can pass your little things to the side, if you mark something on it, just pass it off to the side, and that way I can grab them and make sure I'm stopping to see you. Okay? Thanks, everyone.
Hey, good afternoon, everybody. I'm Steve Brzezinski, and we have Rena Carr and Stephanie here from Highmark. Now, as Leslie and Carrie indicated, is our open enrollment period. So now is your opportunity to make a change within the plan, whether that's the medical, the dental, or the vision plan. There are two changes that Rena will go through on the medical plan. One, you'll know we're moving from Community Blue Flex to what's called just straight Community Blue. It's a benefit to you. If you remember, over the last couple of years, all we talked about was the battle between UPMC and Highmark, and how we had three different, we had enhanced, standard, and out-of-network. We're back to in-network, out-of-network. Good news. And Geisinger is now part of the enhanced network. So all good, but you will be getting new ID cards with that. Also, with the IRS changing the rules on HSAs, you'll see that the deductible went from $1,350 to $1,400, and from $2,700 to $2,800. Within your packet, it talks about what the county's doing with some of the union contracts with that you can review and look at. The dental and vision remain the same. There's no change within those at all. The rates remain the same. Again, as I said, if you don't have the dental or vision plan and you want to, add or delete it, now's the time to do it. We still do have the vision plan within the medical as well that's out there. That's an integral part of it.
I want to interrupt you
Sure.
for a minute, Steve. I want to go back to the deductible being raised 50 and 100. So an individual is going to pay $50 more in 2020 towards their deductible. Any other coverage level is $100. What's going to happen is the first pay in January, if you're an individual, the county is going to put $50 in. So basically, it'll be seamless. So even though, yeah, it's going to cost you $50 more, the county's going to give you that $50 as an individual. Any other coverage level, $100, that'll be put onto your HSA card that first pay in January, and I don't remember the date of the first pay in January. I'm going to say the 7th or 8th, whatever it is. So basically, that money will be available after that first pay in January. Thank you.
So the nice thing is if you're healthy and you're not using your health insurance for anything, you just have $50 and $100 that the county's putting in your account. So that being said, the Community Blue, you're going to be getting new ID cards. So everybody will be getting those in the mail. You should have them prior to January 1st. If somebody doesn't, you can certainly give a call to the number on the back of your card, get a hold of us, see Veronica or Carrie. We'll get you a card, make sure that you have it out there.
And that comes in those unmarked envelopes, right?
Yeah, and
Don't throw it away thinking it's junk mail, because it's going to be in an unmarked envelope.
And that's one thing that Rena always hits on, and I can tell you I'm guilty of doing that. And my son just ordered a credit card, and I thought it was junk, and I threw it out as well. So you really do have to watch those unmarked envelopes. So keep it in mind, you will be getting those new ID cards. Your HSA cards remain the same, just keep those. All right. So with that, I'm going to turn it over to Rena.
Thanks, Steve. Well, good afternoon, everybody. My name is Rena. It's certainly my pleasure to be with you today from Highmark Blue Shield. And my portion of the presentation is really geared to provide you a nice review of your medical plan, to talk about the spending account, the HSA, and network or provider access, as well as a number of additional resources that you all have as Highmark members. And a lot of times we refer to those as value added. So if you have questions as I go through, it's meant to be informal. Please feel free to shout those out. If you're like me, you might forget about what you wanted to say by the time I start talking. So And so basically, as a Highmark member, you maintain access to the most extensive national network of quality providers. So not only do you have coverage here in Pennsylvania, but throughout the United States and even abroad if you choose to travel outside of the country. To give you an idea of the continued strength of the Blue Cross Blue Shield network, 96% of all facilities and 95% of all physicians continue to participate nationwide. That, of course, includes a number of world-renowned facilities that we all hear and think about, like Johns Hopkins, the Cleveland Clinic, and Mayo Clinic, to name just a few. In addition, you probably remember referrals aren't needed, so you have direct access should you need care from a specialist or cardiologist. And I'm sorry, I wish I had it quicker, but I don't think I do. And locally, you continue to have access to over almost 12,000 physicians. 2,800 of those are within the Allegheny Health Network, 100 urgent care and clinic centers, and over 50 acute care hospitals. So your network continues to be very robust. Here locally, you continue to have access to all the local facilities here in Jefferson, any of the facilities affiliated with Penn Highlands, Punxsutawney, the Indiana Regional Medical Center. And in Allegheny County, you would have access to all the facilities within the Allegheny Health Network, which would be Allegheny General, Allegheny Valley, Forbes Regional, West Penn, and others, as well as independent facilities like St. Clair, Armstrong County, Clarion, which we mentioned. In Erie County, you would have continued in-network access to LECOM, which is with Mill Creek Community, Warren General, St. Vincent as well. In addition, you'll notice here in Allegheny County that although most of the UPMC-owned facilities are out of network with your plan, Children's Hospital as well as Western Psych remain at the in-network level of benefit. In addition, that would also include a number of regional facilities, and those that continue to be in-network would be Northwest, Altoona, Bedford, Kane Community, and then others outside of the area, Jameson Memorial, Horizon would be some good examples as regional hospitals that continue to be in network. Keep in mind that if you are ever experiencing a life-threatening medical event, a good example is chest pain, right? You would always want to get yourself to the nearest facility as quickly and safely as possible. You would never want to think, oh my gosh, is this hospital in network? Do I need to travel further down the road? The answer is no. Those services through the ER will always be paid at the in-network level of benefit. And that doesn't matter. It could be here locally, it could be in Erie, it could be in the heart of Pittsburgh, it could be traveling on vacation. That care will always be paid in network. Okay, really important. Additional things that we talked about earlier, it's just important to note that there are those exception facilities that remain intact with your plan. All right, so let's take a look at the medical grid. I know it's within the packet, but this does do a nice job of explaining it. You'll notice rather than the 3 columns, your community plan is simply in-network or out-of-network. And although the plan does allow you to go to a non-participating provider, I always like to remember each year to remind you, for whatever reason you would choose to utilize a provider that does not participate or who is not in network, it's going to cost you significantly more out of your own pocket. And that we can easily see would be in the shape and form of greater deductibles and co-insurance. But on top of that, and where it can become extremely expensive, is that a non-participating provider may also elect to balance bill you, meaning they could charge you the difference between their total charge and the Blue Cross Blue Shield allowance. And depending on the type of care that you may need or incur, that can be a difference of hundreds, even thousands of dollars. So it's really important that we're always staying in network. And we'll talk about a number of resources that we have available to you that can help you make sure that you're always utilizing in-network providers or how to go about finding that care. So let's focus on the in-network level of benefit. As we mentioned earlier, the in-network deductible for an individual is $1,400, and this plan's effective January 1st. For those of you that have family coverage, meaning you insure more than just yourself, that family deductible is $2,800. Once you meet your deductible, you are now considered in benefit, and the plan bumps up payment to 100%. A couple of things to remind you of regarding a qualified high deductible health plan, which this is of course, is that all services, medical as well as your prescription drug expenses, all go towards that deductible. All right, so in other words, there's no payment made by the plan until you meet your deductible. There are no co-payments when you present for a doctor's office visit, or if you need to go to the pharmacy to pick up a prescription. You will pay 100% of the discounted cost of that medication until you meet your deductible. So it's important to always remember to provide your Highmark identification card if you're at the doctor's office or present at the pharmacy, which they typically always ask you. I know I could be at the doctor a couple times in 1 week and they're still going to ask for that card. And that's to make sure that they're submitting that information properly and you're getting credit towards your deductible. Okay. Another thing to keep in mind about this plan is that if you have family coverage, meaning you cover more than just you no longer have an individual deductible. And what the heck does that mean? What that means is you or a combination of your family members must first hit your family deductible of $2,800 before the plan begins to kick in. Okay? So just some good reminders about the plan and how it works. Any questions about that so far? Perfect. There is an exception. Remember I said all your services are subject to that deductible? The exception to that is preventive care. And in the packets that you received, when you take a look at that, is the 2020 preventive schedule. This just came out, so the meetings are perfectly timed. This is basically a listing of those services that we are entitled to have based upon our age and gender and are paid by the plan at 100%. So common examples for everybody, men, women, and children, the routine physical. For women, the routine gynecological exam, mammograms, pediatric immunizations for children are all great examples. I myself take this with me to the doctor's office, so I'm glad that you don't have to print it, it's already available to you. And it helps me have a conversation with the doctor. So if you're ever apprehensive, this certainly makes it easy for me. And they usually know when I have the preventive schedule where the conversation is going. But I may say something like, listen, I'm here for my routine physical today. It's paid at 100%. It's on the list by my plan. But if you plan on ordering additional services today, let's talk about it. Because if it's not on the list, I might have additional responsibility or payment information that I need to take care of. So I want to know about that today, not 2 to 3 weeks later when we get, this isn't a bill in the mail, but it sure looks like it. And this often happens associated with lab work that the doctor might order. So I know myself have been guilty of the doctor saying, you know, we'd like to do some lab work, and I don't really even know what type of lab work they're doing or why they're doing it. So this is a good time talking about the preventive schedule. Number one, that they're submitting those services properly and correctly with the right codes the first time, so we're not having to make additional calls to the doctor's office or the insurance carrier to have things resubmitted. And it also gives us an opportunity to be our own advocate for our health care. Well, can you tell me more about the services that you're ordering? Why do you think they're important? What are they going to show you? That sort of thing. So I found this tool to be very helpful, and I hope it is for you as well. Prescription drugs, we talked about under your plan, those would first accumulate towards the deductible. Once you meet your deductible, medical and prescription drug expenses are paid at 100%, okay? You have a comprehensive formulary, which everybody wants to have. Our formulary listing is available to you pre and post password through the Highmark member website, and that web address is on your current identification card and your new card as well. So what makes that nice is if you ever want to check on how a particular medication might be perceived under the plan, or what type of drug, meaning is it generic, formulary, or non-formulary, you can find all of that out through the website easily. This is a great tool to have. You have the capability to have your medications filled at either the retail pharmacy or through mail order. Typically, mail order is for those of you that may have maintenance drugs, so something that you're taking on a daily basis. You have locked in on a milligram dosage. It's not fluctuating day after day. This is a great opportunity to really save yourself money and the group as a whole, because typically through mail order, you will receive a 3-month supply for what you would pay for just a 2-month supply through the retail pharmacy. I think what holds some of us back is you think, oh my gosh, this is insurance. They're going to have me jump through all these hoops to sign up for mail order. And it's really not the case. Basically, you would just reach out to your doctor, let them know that you would like a new prescription indicating a 90-day supply, and most often they're going to send that electronically onto your doctor. It continues to be administered by Express Scripts. Okay. And this really gives some additional information. That's probably the easiest way to go about that. For those of you that have a maintenance drug now, you can actually transfer that or sign up to get that through mail order through the Highmark member website. If you have an allergy to computers and you don't want to do that yourself, you can always reach out to the service number on the back of your insurance card, and they can help you reach out to your doctor and get that process started for you. So there's a lot of easy ways to make that happen. So let's talk a little bit about the health savings account. So you all know that you have a qualified high deductible health plan. Most of you have established and are able to contribute to a health savings account. In a nutshell, the HSA, sometimes referred referred to is a tax-advantaged account that's available to individuals whose only healthcare coverage is through a qualified high-deductible health plan, just like the one that you have here. Since your deductible or the amount that you have to pay is high before the plan begins to kick in, establishing this type of an account can, number one, help you fund that deductible, and number two, it's a great way to save money due to the tax advantages that are associated with these accounts. In essence, it's a triple tax savings because any amount of money that you're able to contribute to this account, payroll is the best way to do that, you're not going to pay taxes on it. You can earn interest. Once you have a minimum of $500 in the account, you may also elect to invest that money in a number of mutual funds. You don't have to do it, but it is an option. Any investment gains that you may make are also non-taxable. And then finally, when you take the money out of this account to be utilized for eligible medical expenses, that amount is also non-taxable. Okay? It's portable. So if you were to leave the county for some reason or retire, any amount of money that you or your employer has contributed to that your account is yours. So it follows you. There's not a use it or lose it provision like you've heard with other types of an accounts, like a flexible spending account. Okay? And the idea with these types of an accounts is you can use it for today, for medical expenses that you incur today. Some folks like to sock that money and through the years accumulate that money down the road, because any amount you accumulate and don't use year after year is going to roll over to the following year. Okay, so some use this as a savings account for later down the road, even in retirement. Each year, the IRS determines the amount of money that we can contribute into this account without paying taxes on. In 2020, that amount has increased a bit. It seems to about $50 to $100 each year. For an individual, that amount, this would be any amount you contribute or any amount that the county is contributing for you, may not exceed $3,550 for an individual. And for those of you that have family coverage, you insure more than just you, that amount is $7,100. For individuals over 55, you may also contribute an additional $1,000 into your health savings account as a catch-up contribution. Okay. Keep in mind that if you were to use the money in your health savings account for something not deemed eligible by the IRS, you would face a 20% penalty if you were audited. But age 65, however, if you choose the money in that account for something else other than medical expenses, you can do that. You would not face a penalty. That amount of money would be taxable as income. Okay, just some reminders about the account. Okay, so what are some eligible medical expenses? Basically, anything that goes to your deductible under your medical plan. So office visits, spinal manipulations when you go to the chiropractor, x-rays, lab work, surgical procedures, prescription medications, and also things that are not covered under the plan, meaning things that do not go towards your deductible or aren't covered by the medical plan itself. And most commonly, those are services that are otherwise unreimbursed, like dental expenses, vision expenses. So it could be eyeglasses or contact lenses, LASIK surgery. That's a great example. It's not covered under the medical or vision plan, but this is something that many people think about, plan ahead, sock that money away, and you have a great savings account for that, and you're not paying taxes. Another big one is braces for your children. A great way to funnel money through that account without paying taxes on it. So those are some very common examples. Keep in mind that once you are eligible for Medicare, and we're going to talk about this in a moment, you are no longer able to contribute to the health savings account. But again, any money that you've been able to contribute over the years is for you, you'll never lose it, to utilize towards medical expenses that we talked about, and even some more things that we will talk about. Okay, so keep in mind for the health savings account, you can earn interest, although it's minimal. You may choose to invest in a number of mutual funds that are available. And again, you have the capability for catch-up contributions after the age of 55. So, to be eligible to contribute to a health savings account, you must be at least 18 years of age, a U.S. citizen or green card holder or U.S. resident. You must have a residential address and a U.S. Social Security number. You must be enrolled in a qualified high deductible health plan, which we've established. That is the plan that you're all enrolled in here. You, as the policy holder, may not have other health insurance that is not a qualified high deductible plan. You may not be claimed as a dependent on another individual's tax return. And finally, you may not be enrolled in Medicare to contribute to a health savings account. Any questions on that? Yes?
I have a question. What happens if somebody who may not be a citizen, they need health care and you're married to them? Can you still do that?
So if they are not an eligible tax dependent, you would not be able to use the money in your health savings account to pay for those expenses.
Okay.
That's a good question, and it does bring up another point that even though you're able to cover your adult dependent children up to the age of 26, if you're not able to claim them on your tax return, then you would not be able to utilize the funds in your HSA for that too. So that's something to think about as well. Most of you, if not all of you, are probably already enrolled, but if you are not, once you choose the high deductible health plan, you're automatically enrolled in the HSA, so there's not a bunch of things that you need to do to get that opened. If you're new to the health savings account, you will receive a welcome kit and a debit card. And we mentioned earlier, just like all banking or credit card information, it will arrive in a discrete envelope separate from that welcome kit. And of course, you have instant access to the funds and the capability to monitor and manage the health savings account as well. At age 65, you can also use any money in your health savings account for additional things that we haven't yet discussed. COBRA premiums, if you're ever in that situation. And long-term care insurance is another great one to think about too. When you're no longer enrolled in your employer's qualified high deductible plan, this could be that maybe you retired and left the plan, or you're no longer with the health insurance for whatever reason. You can maintain your health, your HSA with the same custodian, which is through PNC. You'll keep the same account number, but you will get new debit cards. And all those sort of things would be reminded to you by HR if and when that would occur. Any questions on the medical piece, provider access, or the health savings account before we kind of conclude the portion and talk about additional resources that you all have? This is a really quiet group.
It's after lunch.
Yeah, it is after lunch. Oh no. So I wanted to talk just a little bit about some great ways that we can all keep our medical costs down without sacrificing clinical care. And there are some really easy ways depending on where we are and the type of symptoms that we're having. So for example, the general rule of thumb is the moment that we step inside a hospital setting, we're going to pay a lot more than for services. So one of the examples would be if you ever need advanced imaging like an MRI or PET or CAT scans. If we're able to have those at a freestanding imaging center, they're going to be significantly less expensive. And we have the tools through the Highmark Member website that you are able to determine that through our cost transparency tools. And those give you the opportunity to compare common elective procedures from one provider to another. And they can vary significantly. Lab work is another great example. If we can have that as an independent lab, we're going to pay about 50% less than if we were to have those services performed within the hospital. So a lot of great things that we can do.
So it's typically cheaper to have your doctor do your blood draw than to go to the hospital for the blood
Most
draw, right?
definitely, yes. That's a great example of that. And by the way, if you ever need help determining, where you could go or where you could ask the doctor to write a prescription for rather than a hospital, we'll talk about some toll-free numbers that you have access to as Highmark members that can help you, guide you down that road as well. Other helpful tools. The member website, I've alluded to a few times. This is a great tool. The web address is on the back of your Highmark identification card. The formulary is available pre and post password, as well as our provider search tool. So I like the search tool because it does give us specific information about a number of practices, such as are they open to new patients, parking availability, office hours, and also specific information about the physicians within the practice, their credentials, quality measures, patient reviews. So I do like it that way. You can also utilize the website for other things, like we talked about the cost transparency tool. If you're ever looking to print a duplicate copy of the explanation of benefit, maybe to match up a bill that you receive from the provider, this is a great resource. We have a member discount program that works very similar to AAA, so there's a number of great resources as a registered user of the website. Now, on the back of your Highmark identification card, another resource that's available to you is Blues on Call. Is that all familiar with you, to all of you? Yes, some of you. So Blues on Call is basically available to you and your family 24/7. Anytime you have a medical question or concern, you may contact this number and speak to a medical professional, such as a registered nurse. So maybe you've had previous lab work and you're really not understanding what those numbers meant. You don't remember what the doctor said. This is a great opportunity that you can pick up the phone, talk to a medical professional such as a registered nurse that can help sort that out. They can also give you some additional support regarding treatment options. Or maybe you're having something right now and you're really not sure what you need to do. Should you go to the ER? Shouldn't you? They can help you with that. Blues on Call also offers a number of what we call chronic condition management programs. This is going to give you the opportunity to have your own personal health coach to help you manage a chronic condition. Maybe it's diabetes or coronary artery disease, asthma. They have a great depression program. Or maybe you're healthy, you just want to make some lifestyle changes. Maybe someone to help you manage stress. It's cookie season coming, right? How can I eat all those cookies I love to make without gaining 10 pounds in the next 3 months? So you can talk to a dietitian every Tuesday night if you want to get some tips and strategies to get us through the holidays. And all of this is available, no additional cost. It's all included in the plan. One of the reasons I mention all that is because that very same number with Blues on Call is another resource. And this department is My Care Navigator. And the folks there can do things for you such as verify participation of all your medical providers as well as pharmacies. They can make doctor's appointments for you and the family, even assist in transferring your medical records from one practice to another. And they're not going to charge you. I recently was changing from one doctor. They were going to charge me $25. I about went through the roof. I'm like, what are you talking about? Why I didn't take my own advice? Call My Care Navigator. They can take all that legwork, headache out of it. All those things that bog us down during the normal work day, they can certainly take care of. Stephanie is with us today as well from Highmark, and she can do all of that for you today. So if anybody is interested in maybe finding a doctor, or maybe you're looking for a specialist for the first time and you're not sure where to go, she can help you with that. Outside of that, you can always reach out to My Care Navigator as well. All right? Any questions on those resources? Of course, we continue to offer a large suite of health and wellness resources that are intuitive and personalized. And one of the brand new ones to Highmark is ShareCare. This is a health and wellness platform that is really a great way to jumpstart any health goal that you're trying to meet for the first of the year. You simply go to mycare.sharecare.com to get started. And if it sounds vaguely familiar, probably it might be regarding Dr. Oz as one of the co-founders. Have anyone heard of the Real Age Test? This is basically a health assessment. It takes less than 10 minutes to complete. And this, based on how you answer the questions, is going to assign your real age versus your chronological age. Now, this was a health assessment that piqued my interest and is definitely a motivator. And from there, once you go to the website, you can also download the app, and then you could receive a live feed of personalized information that's relevant to you that can help you meet your health goals. So I would encourage any of you that are interested. There's no cost for that, of course. Highmark offers a relatively new program to manage diabetes, or let's say it's a pre-diabetes program. This is free to you. To access it, you would go to the Highmark member website, and on the landing page, you'll see a link, Diabetes Prevention Program. When you click on that, you can go through a very short questionnaire that's going to determine your eligibility. You may participate at the local Y. Most people participate online or through video conferencing. I have a coworker that has had remarkable success. So they really make it easy so you can stick with it and kind of work it into your lifestyle. So these are for folks that are pre-diabetic, you may not even know it. The CDC is telling us 1 in 3 Americans actually have pre-diabetes, which is completely reversible and treatable, meaning you're not going to get diabetes. But a lot of people don't know, so you might have diabetes, and you all know if any of you have diabetes, you can't get rid of it. You have to manage it for the rest of your life, and it can also cause additional health problems. So this is a great program. To qualify, I know that you may not have had a previous diagnosis of diabetes, and you must have a BMI of greater than 25. And if you qualify for the program, it's a 12-month program, so it's pretty intense. You'll have your own health coach to help you along the way, and you will also receive a wireless scale and Fitbit tracker as well. Telemedicine. I would be amiss not to mention this. Telemedicine gives you the capability to be treated by a U.S. board-certified physician 24/7. So it could be over the phone, Skype, or FaceTime. Has anyone used it? No? This is really an affordable, efficient way to receive care. It's for minor medical ailments that we all suffer from. So particularly this time of year, it could be bronchitis, the flu, a sinus infection. Maybe the children come down with an ear infection or pink eye. Rather than picking everybody up, getting them bundled up, and going to the pediatrician's office, this could be a great alternative to that. Maybe the pediatrician's office is closed, it's Saturday afternoon, or you're not able to get into your primary care physician's office timely. It's a great alternative because the physicians here can diagnose, treat, even prescribe medications when warranted. I travel a lot, so this has been heaven sent when I just can't get home to my family doctor. There were times where I'm sitting in the parking lot in between meetings, calling, talking to the physician, and I can see the pharmacy down the way. So I'm like, yeah, could you call in the prescription there? And by the time I show up, it's ready and waiting. So really an efficient way. And to tell you the truth, telemedicine providers can typically treat about 80% of urgent care providers can treat. So significantly less, especially when you want to keep those HSA dollars in your account. I would say we use Amwell.com as our preferred vendor, so that is who you'd want to register with. I would say approximately a $60 charge, and that of course would be subject to deductible to give you an idea, versus an office visit that's well over $100 or $200. So Amwell.com is the provider. I recommend that you register prior to needing it, and by registration, they'll ask you for your insurance card. I'm saying, time's up. When is she gonna stop talking?
When you're hard of hearing, you have to turn it off.
That's no problem. That was my timer. And it'll ask you what sort of prescriptions or allergies that you have.
Come on, Alan, is that your wife calling? Is that 800 or something?
So keep in mind that you have that available to you. It could be a real lifesaver. Additional resources, the member service number is on the back of your insurance card, so we don't want you to feel you're on a deserted island. There's bound to be issues or questions that come up throughout the year. That's a great resource. We've talked extensively about the member website, who's on call, a number of resources that you all have. We have a number of innovative ways to find a doctor, and one of those, you might have saw, I call it quirky commercials regarding Dr. Match, the drmatchquiz.com. This uses an algorithm very similar to dating sites, and I thought, you know what, I'm gonna try it. I had to find a new doctor, and I was really upset over it, and I had talked to a number of friends and family members, some co-workers, and I had someone that I thought was gonna work out pretty good, but I thought, you know what, I'm just gonna try this and see if it matches them to this doctor. And that physician was in the top 3 that they listed, so it certainly worked for me. So I would say if you're looking for a doctor, especially a primary care physician, this might be a great way to get started. Any questions or concerns about anything that I talked about before I turn it over to Steve?
I just wanted to ask her, those resources or those slides that are up there, are they in the packet that we received?
I believe most of the information is in the packet. Yes, a handout for each item.
Okay.
Yes. All right, well, thank you all for your time and happy Thanksgiving. Thank you.
I think, Tracy, the information, a lot of it is in the first, I don't know, 10, 12 or so pages.
That seemed more like a cheat sheet, you know, where you could just do a real quick look. I didn't know if those
I don't know
slides
what
were-
particular slide
Okay.
is, I would say no.
Okay.
But a
Not
lot
the
of that
slide,
information is. If you go to the Highmark website, you're gonna probably find most everything, am I right? Yeah.
Right.
So if you haven't gone on there, again, that's a really intense website, tons of information. You could be in there for hours as well, just checking on stuff, looking at stuff, and yeah, it's pretty awesome. So, you got something to add now, Steve?
And what I was just gonna say is, remember, it's open enrollment. You have a system here that you can go to do any changes. I can't remember the name of it, I'm sorry, what's the acronym that you call it?
Our HR portal?
The HR portal. So please take advantage of it. That's the reason why these are all here. And if there's any questions that you have relative to my care navigator, Stephanie's here, and certainly Rena and I are here to answer any questions as well. Other than that, if you can't think of anything.
Oh, I got lots of stuff here.
Okay.
Yeah. So I wanted to give you some reminders specifically about the HR portal and what you need to do, you know, those types of things. So the first thing I want to make sure that you all know, even if you're not making changes, you still need to go into the portal, review your previous year, this year, 2019's elections, and really you're going to just kind of go through clicking and saving and proceeding all the way to the end. So even if you're not going to make changes, review all those, continue on until you get to the end of that process. I also want to make sure that you understand that if you're adding any dependents, you need to make sure that they're added under your contact dependent portfolio on the HR portal. So when you go in the portal, you have to say add baby Jane Doe and social and all that kind of stuff. And then there's a box in there that you're going to have to click that he or she is a dependent, okay? Changes to your coverage is a two-step process. So one, you have to do it on the portal, and two, you have to follow up with paperwork. You have to fill out the form. You have to submit that form. You need to have both of those steps done, the paperwork and the portal side of it. If you're enrolling in an insurance, you need to have a form. If you're dropping an insurance, you need to have a form. If you're enrolling or increasing or decreasing the amount in your HSA, we need to have a form. So think of it this way, the form is what we take and we send off to Steve's office. They process it, they send that to Highmark, they process and enroll you in those plans. If you only do it on our HR portal, they, meaning Steve's office in Highmark, they don't have access to that information. That's why it has to be that two-step process. So, yep, I put all those forms in your packet, by the way. So, all that information has to be sent to them so they know, and then we also here at the county level need to know.
Karen,
Oh,
along that line, a new update to the website that we had. You can now attach the documents, you can upload and scan and upload it, so you don't have to send that actual paper over to HR. It can be uploaded through the HR portal. But you have to make sure you scan it signed. We'll accept a signed, scanned, but it has to be signed.
not a typed signature. Word signature. Open enrollment will close December 4th, at the close of business that day. And I just want to remind everybody, there's several steps in this process. So even after we close open enrollment on December 4th, we still need to gather all that information, make our changes in our system, send all that over to Steve, have them do all of their updates. They send all that to Highmark, and think we're just one of, I don't know how many entities go through on December enrollment, hundreds of thousands, I would guess, right? So, you know, there's a little bit of a processing time that needs to happen. This year we went probably 2 weeks earlier, I believe, than last year, so hopefully we can get this done a little bit quicker. But all of that has to happen before you're gonna get your cards for, you know, your new coverages, if you're enrolling in something new this year, or the new ID cards, which everyone will be getting for the health insurance. New health insurance cards will be mailed to your home address on file, so make sure that, you know, in the portal, if you've moved, you've given us that address change, not only in the portal, but also on paper, in the forms list. You know, there's those address change forms, we need to have those as well. Something I also want to mention, if you possibly can, refill any prescription before the end of the year. Because on January 1, you're going to start at 0 again until you get to your deductible. So if you can get any prescriptions filled before December 31st, that's what you want to do, is get those taken care of. So come January 1, you're not already starting to pay out of pocket again. We will have the video that Paul is taking back there of us and this meeting on the HR portal. I'll send out, or Veronica or Lisa, one of us will send out an email letting everybody know. So if there's something that you forgot or want to look at again, you can look at the video, and that should help remind you. I want to make sure that everybody got a ticket. Is there anybody, I see there's some on the floor right there by you. Did everybody get one of these tickets? Did everybody get one of these? Lisa Molly needs one over here. Tanya needs one. Sue needs one. No? No. Okay, I got Sue.
I just want to clarify too, for change of addresses, in order to be cleared through the clearinghouse for HSA, you have to have an actual street address and not just a PO box. So if you put in for a change of address and only have a PO box, we also need to have a street address.
Right.
Yes.
Do we have to do a new HSA enrollment, or can it stay, if we want to keep the amount that we're contributing this year the same as next year, do we have to do anything with regard to that?
You have to go down through and just, like I said, in the portal, just accept,
Everything.
save,
Okay.
accept, save, till you get to the end. You wouldn't have to fill out a new form.
Okay. I
Yeah.
have another question. So where can you find what the difference is between the dental insurance and the dental buy-up?
On the HR portal, it'll
Okay.
give it, you can see, the form itself.
Okay.
The only difference is orthodontia, I think, for the most part. One has orthodontia, the other one doesn't.
Yes, Karen?
Are our insurance rates going up?
Yes. The rate information, there you go, Taylor, is, I don't know, towards the middle maybe. There's a grid that shows what the premium is, what the county pays, what the employee pays. That's the top part, as well as the vision and the 2 dental plans.
About $13 a family.
What's the percent increase?
I don't remember the number, Steve.
It's about 15%.
Say 15?
Well,
Like last year?
Last year
No.
wasn't 15. Last year was less than 15.
Last was 5.17, I remember that one.
Okay.
You know how the county put the $1,100 in?
Yep, that information's in the packet as well. Lisa?
Oh, she's just giving somebody.
Yes, here's tickets.
The county match will be the same as we did it this year. It'll be a look-back period from June 30th to the beginning of the year, and then December 30th, or the last pay, should I say. And I do a spreadsheet and I do a comparison. There's some people that like to front-load their full HSA at the beginning of the year because they know they're gonna need that deductible at the beginning of the year. I'm not gonna short pay you in the second half of the year. I'll do a complete year look back, and if you've met that full amount to get that county match, I'll do that.
In your packet, there's this form. It explains, same as same as 19, the 2020 with the 550 max for the individual and 1100. And like Veronica was saying, half of it January through June, and the other half July through December, last pay in June, last pay in December, matching up to those maxes. And then the second bullet point is explaining the additional 50 for an individual and the $100 for any other coverage level due to the IRS regs change, that will be put into your HSA account that first pay in January. Okay, everyone find that one in there? Seth, you had a question?
That was actually my question.
Okay. Alright. So, did everyone get a ticket now? Alright.
Thought you were leaving.
So, one other thing I wanted to say before we do the drawing for one of these lovely umbrellas. And they are really cool because they're those upside down ones. Have you seen them? Like I played with them because I never saw them before. They are. But what I wanted to see, I don't know how to work. There we go. So what I wanted to say is that we have the 5 kiosks set up here. It's already to the HR portal. All you need to do is come up, kick these folks out of your way, sit down, put in your credentials. You can make any changes, or if you're not making changes, just click on through like we said, just save, continue, save, continue, get through that, boom, you're done. If that's what you want to do, if you already know what you're doing, you can do that today, walk out of here and know that it's done. If you are making changes, you already have those forms printed, they're in your packet, you can fill them out, do your changes on the kiosk, fill out your forms, hand them in, boom, you're done. Either way, December 4th is the deadline. So, did someone say something? Someone have a question? Okay, so if nobody has any questions, what I do want to say is that Steve's available if there's any questions about the coverage. The girls from Highmark can answer questions about the coverage. Veronica, Lisa, and I can answer questions about the portal. We want to help you guys. And by the way, did everyone get sick of like all my emails and my things I put on your windshield wipers and your desk and your break rooms and your like
Nobody
Look
has
how
made
many
it.
people I got here today, it must have been effective. Well, we weren't sure on some vehicles, so I didn't wanna just like put them on random cars, but, what I'd like to do is, Lisa has the bowl for the, one umbrella, we'll have another meeting tomorrow for a second umbrella, and then everybody from today's meeting, tomorrow's meeting, the second half of that ticket is going into a big bowl, and that will be for the TV up there. That Steve very generously donated, so we'll have that drawing tomorrow. But, why don't we have one of our presenters draw that?
Get your umbrella.
How many?
Get your umbrella.